Hello everyone, my name is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, Babu Banarsi Das College of Dental Sciences, Lucknow. Today's lecture is on cheiloscopy and rugoscopy. Cheiloscopy is a forensic technique that deals with identification of humans based on lip traces. Now, lip prints have to be obtained within 24 hours of time of death to prevent erroneous data that would result from post-mortem alteration of lip. The pattern depends on whether the mouth is opened or closed. In closed mouth position, there are well-defined grooves. In open mouth position, you can see ill-defined grooves and difficult to interpret. So classification of lip prints by Santos, it is simple wrinkles and compound wrinkles. Simple wrinkles, straight line, curved line, angle line, sign-shaped curve. Compound wrinkles, bifurcated, trifurcated, and anomalous. So there is one important classification by Suzuki and Soshiashi classification of lip print. It can be type 1, type 1 dash, type 2, type 3, type 4, and type 5. In the picture also you can see all the types. So type 1 is clear-cut vertical grooves that run across the entire lip. Type 1 dash, it is similar to type 1, but do not cover the entire lip. Type 2 is branch grooves. Type 3 is intersected grooves. Type 4, reticular grooves. Type 5 grooves that cannot be morphologically differentiated. So these are the few examples. Like in the upper first picture, you can see lip print showing type 1 groove in third and fourth quadrants medially. In the upper second picture, you can see lip print showing type 2 groove in third and fourth quadrant. In the lower first picture, you can see lip print showing type 5 groove in third and fourth quadrant. And in lower second picture, you can see lip print showing type 3 groove in first and second quadrant. So method used for developing the lip print is powder method, chemical method, X-ray method. A combination of these groups may be found on any given set of lips. To simplify recording, lips are divided into quadrants, which is similar to dentition. Like we draw a horizontal and a vertical line. So horizontal line dividing upper and lower lip, vertical line dividing right and left side. By noticing the type of groove in each quadrant, individual's lip print pattern can be recorded. So lip prints are usually left at crime scenes and they can provide a direct link to the suspect. So they are also helpful in gender determination. Recently, there are lipsticks which have been developed that do not leave any visible trace after contact with the surface. There are disadvantages also of lip print investigation. Like major trauma to the lips can result in scarring. Then there are surgical treatment rendered to correct any abnormality. It may alter the pattern and morphology of the grooves. The prints produced may differ in appearance depending on the pressure applied and its direction. Now, what is rugoscopy? The study of palatal rugae in order to establish the person identity. So, what is palatal rugae? These are irregular, asymmetrical ridges of mucous membrane which are present on each side of mid-palatine raphe and behind the incisive papilla. So, in this picture also you can see the palatal rugae. So, rugae appears 3 months of intrauterine life. It does not grow after age of 10 years and it remains stable. Physiologically, it is involved in oral swallowing and they participate in speech also. In suction in children, its design and structure are unchanged and are not altered by chemicals, heat, disease, and trauma. If the palatal rugae are destroyed, they are reproduced exactly on the same site. So classification, it is done on basis of length, position, shape, and direction of various scientists. Lysel classification is there based on length. So Lysel measured the rugae in a straight line from medial to lateral, and they categorized as primary, secondary, fragmentary rugae. Primary rugae are more than 5 mm. Secondary rugae 3 to 5 mm. Fragmentary rugae 2 to 3 mm. Less than 2 mm is not taken into consideration. Kapali et al. Classification based on shape. So it can be curved, wavy, straight, circular. Curved, they had a crescent shape and curved shape. Wavy, if there are slight curve at origin or termination of curved rugae. Straight, They run directly from their origin to termination and circular. There are definite continuous ring seen. So analysis done on basis of position, length, shape, direction, unification. So this is the example. You can see the cast showing the palatal rugae, and these are highlighted. There is highlighting of palatal rugae under spotlight. And then in the lower picture, you can see photo of non-highlighted palatal rugae, photo of highlighted palatal rugae also. And then there is superimposition of both the images, which is done. So when identification by routine methods like fingerprinting, DNA analysis is not possible, use of rugoscopy by photographic superimposition method can be very useful. So the superimposition procedure of palatal rugae was carried out by making one photograph or model transparent. When the photograph of palatal rugae of non-highlighted models were superimposed with the digitized photographs of highlighted palatal rugae, there are 100% accuracy rate of identification. So rugae patterns are traced from antemortem and postmortem dentures on a clear acetate and then superimpose these tracing on photographs of plaster models. So there are computer software programs also that have been developed which makes use of principle commonly employed in fingerprint analysis. The method uses digitized images of palate on which characteristic points were plotted on medial and lateral extremities of all rugae. So this helps in race and sex identification. Like example, we can see straight rugae in southern Indians and curved rugae in North Indians. The advantages are identification of individual due to its singularity and unexchangeable nature, low cost, and racial group identification, sex determination. Palatal rugae did not change as a result of growth and remains stable. Disadvantages are some changes do occur with orthodontic treatment, dentures, and extreme finger sucking in infancy and may hamper the identification. It is not useful in CSI for linking the suspect with crime scene. In fact, those kind of evidence are not found mostly. So always need ante-mortem data to compare with post-mortem data, and there might be chances of forgery. Therefore, it is well established fact that palatal rugae pattern is unique to human beings as his fingerprints. Thus, it is used in forensic identification. Analysis of palatal rugae pattern combined with other method is an important alternative and complementary technique for human identification, and it provides a significant contribution in cases of criminal investigation. That is all for your lecture. Thank you.